During this webinar, we'll be sharing data-driven approaches and evidence-based practices for understanding and improving mental health needs in your community. My name is Jane Chai, and I'm the Community Health Subject Matter Expert with Conduit Healthy Communities Institute, and I'll be one of your speakers today. As we get going, please feel free to use the chat function to type any questions or comments that we have. And one question we'd love for you to share in chat as we're getting going is how COVID has impacted mental health as a priority in your community. So feel free to use the chat and type that in, and I'll go ahead and get us started. Today we'll have 3 presentations followed by some time for Q&A and discussion. I'll be speaking about processes and resources for data-driven approaches for understanding mental health in a community, and I'll be joined by Dr. Derek Van Brunt, who's CEO of Credible Mind and clinical professor at UC Berkeley. Dr. Van Brunt will be sharing his expertise around adding evidence-based self-care to mental well-being in our communities. And finally, Maricel Losa, President and CEO of United Way of Greenwood and Abbeville counties, will be sharing her experience and lessons learned as part of a local United Way addressing mental health in her community. I'll begin by sharing some background on myself and Conduit Healthy Communities Institute and why this topic is so important to us. HCI is known for providing technology and services solutions to help organizations use data and evidence-based practices for improving community health. We support over 100 community health platforms and have completed more than 200 community health assessments and plans. Prior to joining HCI, I worked at Orange County Healthcare Agency, which is the local health department in Orange County, California. And we actually used HCI's community health platform to help launch and support the Orange County's Healthier Together collaborative, which is a collaborative that includes hospitals, universities, businesses, community-based organizations working together to improve health in Orange County. The collaborative began our work in 2012, and from that very first assessment, mental health was a top priority identified by community leaders and community members. And when I joined HCI in January of 2020, so just last year, I found that Orange County was really far from unique in this regard. Working with health departments, hospitals, and collaboratives across the country, we see that the vast majority of our clients have identified mental health and behavioral health as a priority topic to address in their communities as well. And I think what we all know is that unmet needs, mental health needs, are really having significant impacts on health and quality of life, and we need to act. Another trend we're seeing is that many of our clients are also prioritizing health equity or social determinants of health in their work. I think all of this points to the interest in moving upstream or addressing root causes impacting health. So let's dive in a bit here into the data-driven approaches that can help us better understand these issues. I'd like to begin by sharing HCI's approach for choosing meaningful data for community health. When we select data, we're looking to find indicators that help us facilitate cross-sector or multi-department collaborations, track progress over time, and get to root causes of health inequities. We like data that align with state or national initiatives, such as Healthy People 2030, because they're more likely to be tracked by multiple organizations and at different levels. We also think it's important to use reliable sources that are regularly published, and this really helps us do that progress tracking over time. And finally, the data should be granular enough to show disparities. We find that this is really what informs local programs and policies. Using this approach, we're aware that there are quite a few credible sources of data out there, from national data sets such as American Community Survey and CDC to state or regional data sets such as hospitalization data or vital records. The data can be grouped into 3 broad categories. Those that describe access to mental health, such as insurance coverage or individuals receiving needed mental health services. Those that describe behaviors or needs, such as depression, isolation, or adverse childhood events, ACEs. And those that describe outcomes, such as hospitalizations, ER rates, or deaths. And when you're trying to understand mental health in your community, I think it's really important to look at local data. So I'm going to show here a dashboard that pulls some of the indicators that we just talked about into one place. Being able to look at values, local values compared to state and national values, or look at trends over time really helps you begin to get a broad picture of mental health in your community. Once you have that broad picture in mind, the next thing is to really dive into the data by demographics, such as age, race, ethnicity, or gender. I think in the story in most communities is one about disparities. Here you're looking at hospitalization rates due to mental health by demographics. And as you can see, looking at the data in this way can help you identify populations that are more at risk in your community. Of course, another way to look at the data is by looking at geographies. So mapping your data by city, zip code, or another regional grouping can help reveal which communities may be more at risk. This is a map of age-adjusted hospitalizations due to adult suicide or self-inflicted injuries. Areas in red and yellow are those that are doing worse compared to state benchmarks, while those in green are doing better. And you can also make comparisons by, say, zip codes or the overall county value. And looking at these maps, you can begin to see some patterns emerge about where hospitalization rates are higher compared to state or national values. I'm going to go back to our PowerPoint here. So we've talked a lot about mental health data up until this point, but other data points that we should mention are the social determinants of mental health. Many of us are familiar with social determinants of health, or the notion that health begins where we live, work, and play, and that efforts to improve health must address these conditions. Social determinants also have an impact on mental health. Here I'm showing a graphic from the New York State Office of Mental Health's white paper, where they identify 16 categories of these determinants in 4 broad buckets. There's quite a bit of overlap between this and social determinants of health. So when we're discussing mental health data, I think it's really also important to look at these data points in relation to your mental health data. So looking at the cross-section between these. You likely know that there's a lot of social determinants data available, including on income, poverty, or education. All of this is really great to look at alongside your mental health data, as I've just mentioned. Understanding where there's overlap can help you identify opportunities for cross-sector collaborations. So here you're looking at 2 maps. The map on the left shows hospitalizations due to adult mental health, and the map on the right shows Conduit's index of socio-needs, where darker green areas are those that are of increased socioeconomic need. And as you can see, many of the areas that are red on the left-hand map are also dark green on the right-hand map. And these areas can indicate where partners in 2 different sectors might work together to improve wellness in the same communities. In contrast, there might be communities that show up red on the map on the left and are light green on the map on the right. So those communities might be in need of additional mental health or other services and might have otherwise been overlooked if we're just looking at socioeconomic needs. So I've found personally that mental health needs are really quite complex as they relate to social determinants. So these maps are really just a starting point for understanding the experiences of a community. This leads into the next part of data-driven action. I want to acknowledge that quantitative data, or just the numbers, or secondary data collected by somebody else, like what I've shown so far, doesn't fully capture our community's experiences, especially in light of COVID. We have found that it's been really helpful to supplement data by holding focus groups, key informant interviews, or conducting a community survey to gain more in-depth insights. I'm showing an example of this from a recent community health assessment where we asked questions about the impact of COVID. And I think the results really helped the client get a better picture of some themes and needs in their community. And though we didn't ask specifically about mental health, I think it's interesting how many of these insights tie in to mental health, social isolation, and social determinants of health. And I won't have time to go into all of the questions that you can ask in this process, but these are a few types of questions that you can ask community members or stakeholders that can help you get deeper insights about which communities are struggling, their attitudes towards mental health, barriers for access, and insights about what strategies might work. I wanted to end today with a quote from the Chief Innovations Officer at MindOC, which is the nonprofit behind the Be Well Orange County initiative. Be Well is an initiative using a collective impact approach to improve wellness and mental health in Orange County. And when preparing for this presentation, I interviewed Dr. Karen Linkins to talk about their approach to data. I really admire Be Well's approach, which acknowledges that the mental health system of care involves many different partners. So as you can see in the graphic, this includes the justice system, housing services, community partners, in addition to clinical services. And Dr. Lincoln shared this insight that data can yield the problem and help parties create a shared vision. And I think that shared vision is so important in moving forward. And using common data to create a shared vision allows us to bring those different parts together to work on strategies that can really lead to meaningful impact for mental health. I've included my information here. I think we'll be sharing it towards the end. Please feel free to contact me with any questions, or if you'd like to discuss the situation in your community so that we can help out. I'll go ahead and hand this off to Dr. Van Brunt, who will be talking about evidence-based practices to improving mental health.
Thank you, Jane. Very nice to be with everyone today. This is a huge issue. We're all impacted from a mental well-being perspective over the last year. And I want to transition from Jane's wonderful insights around being data-driven around where are some of the geographic areas and community groups that we need to focus on, and how to build coalitions to focus on that, and shift to an example of an evidence-based best practice of what can be done in a community right now at modest cost, given the severe challenges that we're facing. And I will point out that, we have this chat in this meeting, and I was looking at some of the responses on how COVID is affecting mental health in your community, and uniformly people are responding with, it has exacerbated the mental health issues, it has increased awareness and a need to do something. People are not seeking mental health care like they were before, and it's straining resources. We're going to address, to some degree, all of those right now in the next few minutes. Just to restate, mental health has been a long-standing problem here in the US. I mean, it's not like this is all just caused by COVID. Before COVID, roughly half of US adults had a diagnosable mental health condition in their lifetime, about 20% any given year. And that leads to a lot of lost productivity, pain and suffering, direct costs. And we cannot provide professional therapy and services to get our way out of this problem. There aren't enough therapists and physicians in the country to deal with it. We're at least 250,000 people short on professional services. And that doesn't even address the access issues that are huge. COVID has made the situation even worse. So much so, you just read, the numbers are staggering. A recent CDC survey has estimated that rates of anxiety and depression have somewhere between tripled and quadrupled in the last 12 months. And they were not low to begin with. And here's perhaps the most sobering stat of all, and that is that when the pandemic subsides, knock on wood, we unfortunately can look forward to the mental health problems that have been kicked into place for about the next 5 years. So this problem's not going away. We have a tsunami. We've kicked the hornet's nest. The mental health issues are severe, and we need an approach. This is one conceptual point that I want to make, which is fairly new. Most coalitions and organizations around the country working on mental health are doing so principally with the right-hand side of this graphic, i.e., improving as best they can access and availability to professional services. And that needs to continue. It's a critical part. But roughly 75% of people that have mental distress don't seek professional services. It's not about access. It's about they don't look for that. They're going to do some form of self-care, whether it's Google or talking to a friend. And what we're going to talk about right now is how can we make mental well-being, self-care, evidence-based in your community, and effective for everyone, all the populations that you care about. One question people ask is, does this kind of early intervention or self-care work? Yes. Short answer is yes. We won't take the time today to go through all the statistics, but there is a whole lot we can do, both for people that already have a diagnosable condition to help them manage their condition and alleviate symptoms, as well as help people advance into more severe states of conditions. So we've created something called Credible Mind. You could think of this as an example of a best practice in a community. At the end of the day, it does three things. Choose from over 200 topics. This is, think of anyone, any resident in the community you serve, any employee in the organization where you work, or any affinity group where you're targeted. So choose from over 200 topics having to do with mental wellness. Find what science says you can do to make a positive impact, and then where needed, connect you to resources to make that change. So let me give you guys a quick, super quick demonstration of what this looks like. This is a coalition here in California. They're in the Central Valley. They're called Live Well Madera County. This is the county health department. So it's public health, behavioral health, local hospitals are involved, churches, schools, United Way, many different organizations all working together to improve the health of their geographic community. And this is like a platform that they've made available, and it's sort of an all-you-can-eat buffet. It's available for free to anyone in the community, and it's completely anonymous in terms of utilization, although there's amazing analytics that I'll show you in a moment that comes out of it. Not enough to show you the various 15 features here, but I'll show you two very quickly. One is, on the left here, you see categories of topics. I'm working through the pandemic. I have a mental health issue. I've got life changes like housing or job transitions, the kinds of social determinants of health that Jane was talking about, and many others. I'll just go into one topic that is highly trafficked, which is anxiety. It's very high in our communities. It's impacting people's work and productivity. What can be done? Well, there are three parts to this page. One is that you're not alone and there are things you can do, and some people click and read. Most don't. Most go do the following two things. Here is the list on the left of what you can do. I've been working with someone over the last few years that has anxiety and has been medicated for that. They found on this list two things that meant a lot to them: learning how to just sleep better using an app and some what's called sleep hygiene. And also they found out that playing music and listening to music reduces anxiety. They now play an hour a day of guitar, take their sleep seriously, they're off their meds, it works. It saves money, it reduces pain and suffering. The problem is this information is not in our communities. Things like anxiety and depression are contagious. It's how do we lift the whole knowledge base of the community. So you can click into these and then find out resources to do those things. The third thing is, what are these various resources and how can I personalize them for me? If I'm in Madera County, I can see all the different facts of anxiety, what Credible Mind editors find to be very good, how to get through the pandemic, resources that are available to me locally like 211. And all of these have been vetted. These are not just some random list of resources. These are apps, videos, podcasts, online programs, articles, books, thought leaders, etc. They're all listed at a 5-point scale, kind of a Yelp for mental health. And you can just click and use. And we've added a personalization feature so that depending on who you are in the community, maybe you're a student, and so you want to see resources relevant to that. Maybe you're a parent and you're worried about anxiety in your children. Maybe you want to hear from people that are of a similar culture to you. So there are all kinds of tools here to help people do three things. Find from over 200 topics for mental wellness what science says you can do. Find high quality, personalized resources to help you make positive change. Free, once you have the system in your community. The other thing I wanted to show briefly is a lot of people simply don't know what is bothering them. And so we have a whole library of assessments to find out, is it job stress or burnout? Is this just some off days, or is it really depression? How well am I sleeping? And the results are you get scores on validated scales and recommendations to resources, both within this platform, as well as whatever resources are available locally. So when we work with an organization like yours, we basically customize the system, make it look like you and your coalition, if you're working in one, elevate the topics that are important to you, help you get the word out so you can actually engage the community, and give you analytics so that you can actually see what's working. I'll tell you one story here of how someone is using the system right now, and this is in Madera County. So these are the kinds of statistics you get. What are people in the community looking at? How are those topics trending? What are the of evidence-based approaches that people are selecting? And so it's really exciting when you can see what's going on and what resources should be applied in what areas. So in Madera, for example, in addition to the broad work to all the residents, they decided to make the system available and promote it to their employees. So these are county employees. And they were shocked because all of the following happened in 1 week. One, they sent out a note saying, here are some assessments, like a burnout assessment. It's anonymous. Please feel free to take this. We know it's an issue right now, and we want to see how you're doing. Two, 15% of their entire employee base took it within 72 hours. Three, they found out that the rates of burnout and stress were off the chart, 70% reporting moderate to severe. And then lastly, and the most important, one of the major reasons for the stress and burnout was that people feared job loss. Well, these were county employees. There were going to be zero layoffs. So inside of 1 week, not only did they learn all of that, but they then got the message back out to all the employees that no one had to worry about job loss. So they went from awareness, data collection, insight, and a no-cost intervention that immediately alleviated part of the problem. The issue is they stopped flying blind. They could actually see what was going on. That's the power of analytics. So we work with all kinds of organizations, hospitals and health systems, insurance companies, United Ways, coalitions, universities. You know, we have a very broad group of people here that are on this webinar with us, and you represent the large group that we have, that we work with. So this is the last slide, and it's just a summary for you. If you're thinking about what can I do in my community? How do I think about this? And what's the message I can share with my colleagues so that we can move from ideas to action? So one is, we all know mental health and emotional distress is huge and made much worse by COVID. It is flat out a crisis. And we also know that prevention and early intervention works, and it can be coupled with the downstream, more expensive kinds of professional services. It's not one or the other. Clearly, you have to do both. And community stakeholders, we find, are very interested in doing this. They just don't know what the modestly cost programs are out there that they can implement. And this system that I'm showing you is just an example of what you can do. A personal recommendation I have, if nothing else from today, have your behavioral health team that thinks more clinically and your public health or community benefit team work together, because when they think holistically, you start thinking more population-based mental health, and that's what we all need to do. And there are tools that can help you right now. So I'm going to close with a challenge statement and introduce the next speaker. And that is that you can launch these kinds of technologies, but how do you build awareness in your community? How do you get engagement? And our next speaker, Maricel Losa, who's president of United Way in a couple of counties in South Carolina, has a lot of experience with this. And I'm going to turn it over to her. Maricel, welcome.
Good afternoon, everyone. It is an absolute pleasure to be here this afternoon, and I am going to share with you what we're doing here in Greenwood, South Carolina. But I will start with letting you know that prior to coming to Greenwood, South Carolina, about 3 years ago, I did extensive work along the same lines with a platform, a data platform from Conduit called Miami Matters, which, if you were to check out, is still in existence and does a very significant amount of community work based under the Consortium for a Healthier Miami-Dade. And I'll come back to the importance of connecting the data with a consortium or a group to have those necessary community conversations, as Jane spoke about. But starting with Greenwood Counts, when I came into this Greenwood community, it was a small town. It is a small town, both Greenwood and Abbeville counties, and we're just now adding on 2 other counties, Saluda and McCormick, to the work that we're doing. But we're starting here in Greenwood because as we've started looking at the community overall, what was happening was there was no centralized data collection work going on, and there was no informing the community on an ongoing basis of where the challenges were, where are the gaps, where are the opportunities, where are those bright spots, and how do we replicate those bright spots of the really good work that's happening within those, and where do we focus our strategies and plan effectively for areas of need. So coming to Greenwood, we were able to start our own data platform, working again with Conduit and looking at what we needed at the time, which was this innovative platform that allowed for community assessment, gave us the information we needed for strategic planning, also houses best practices, which is a huge component, especially for the agencies that work with United Way specifically, allows for that collaborative platform and that opportunity for us to post very local information, and of course the educational library and advocacy pieces, and then definitely the visuals. Looking at the value to us, the big pieces that were very important for this community, and again of much need, in addition to the ones already mentioned, was the fact that our tool or our platform connects to 211, and having that ability to access local resources was also a big piece. Best practices, again, as I mentioned earlier, and then the other major one, of course, is funding, which is always the bottom line question is, okay, this all sounds great, but then how do I fund it? So that was the data side of it. And just when we were launching our data platform, and we were so proud of it and really excited about it in this community, in comes our darling COVID-19, who had other plans for this community. And when we looked at some of the data that was happening before COVID hit, our numbers were off the chain with regard to mental health. As you can see, and I'm not going to go through all of these data points in great detail, just want you to keep an eye out on those gauges. As you can see, there's the red, yellow, and green gauges, and obviously when the needle is in the red, we are not doing so well. So if you look at Greenwood, our numbers are not well, and also if you look at us compared to other South Carolina counties and other US counties, we're in the red. So when we look at COVID, yeah, we're not doing well. When we looked at our COVID case fatality rates, we are not doing well. When we look at, and I say, well, just to be kind, we're doing pretty poorly. Our pediatric mental health rates are in a cautionary area. We do have some challenges there. We also were able to really look at our suicide rate, which I'm seeing through the chat box that is a big concern for many that are on this webinar. Ours are pretty much parallel to the challenges that many of you are expressing, and that we're almost in the red, and again having significant challenges, and as you can see, suicide for adults, self-inflicted injuries, adult mental health, I mean, it goes on and on and on, that mental health here in our community is a huge issue. And remember, these are all pre-COVID rates. Now you throw in COVID, and guess where we are? We are significantly challenged. So now that we're able to show our community what they didn't know, because that was one of our big challenges, was that we didn't know what we didn't know. So now looking at the data, having it up front and at the forefront, it makes it very clear and allows us to really focus on, so where are we and where would we like to be? Having said that, then how do we get this information out to the community, not only utilizing the site itself, but then how do we get that information out? So we came together as an organization, hunkered down, and thought about the ways that a small town communicates best. Social media here is a big big opportunity and utilized on a regular basis. So we came up with these Fact Friday pieces of information where we send out messaging to our community to let them know where our challenges are and put us in perspective. Again, these are numbers pre-COVID, so we follow up with a friendly reminder that if since COVID, things in your world have gotten worse, here are some connections to resources, and I'll go into that in just a few minutes. We also started Mindful Mondays because we realized that there is a huge connection with all of these mental health issues and the work that needs to get done in this community. And we started Mindful Mondays, sending out information about Credible Mind, which was another platform that we brought to our community. So being able to show the data, where we are, what we need, and then perhaps some self-help that folks could easily access. Being in a small town, also the challenge is that many folks don't want other folks to know what they're seeking, what type of help they're seeking. Everyone here knows what the neighbor is doing, and so coming from big town to small town, it was an eye opener for me that folks are very concerned. So the ability to have this self-help opportunity and kind of do this research and seek this help behind the scenes was also very, very not only helpful, but very enticing for folks here in Greenwood. In addition to sending out our Mindful Mondays and Fact Fridays, we also send out a newsletter with information on what you can find on these sites. And so we help folks understand, maybe you're thinking about this today, or maybe this is a need that you have, or perhaps you might want to take one of those assessments that Derek was talking about. All of this work and all of this hustle and bustle going on in Greenwood with all of these different platforms had to come to some kind of fruition, and that was the Greenwood Counts Community Consortium. We call it GC3 here in town, and it was a pulling together of all the key folks that really needed to come to the table and have a discussion on, okay, here are our numbers, here's all this great information, but now what do we do with this? And how do we affect change? When we're looking at policy, systems, and environmental change, which are the three top change agents that are necessary, or areas for change that are necessary, we took a deeper dive and we pulled to the table a cadre of change makers in this neutral space to be able to say, hey, folks, we really need you to leave egos, logos, and politics at the door, and let's just really look at what are the challenges and how can we help folks connect to resources, connect to services, and get the help that they need. Again, the ability to infuse the self-help component was a huge plus for many of our community partners. And when we sat down and looked at who needed to be at the table, we did include our elected officials. We included media, which was a huge piece. Our local newspaper is one of our huge champions and stewards of information and help us get that information out to the community. And we looked at changing and starting a movement from community insight into community action. So just not, having the information was just not enough. What else can be done? And dissecting each one of the key areas across 8 sectors and really looking at, okay, here are some issues of concern. How do we take this into account, and what can we design that would be helpful and useful? We also looked at historical, again, small town, have to respect the historical component. What have we done that's been really great? And we want to kind of brush off, dust off, and amplify or enhance. What are the things that we learn lessons from and we move on and perhaps not do that again? And then what are the new innovative things that we can bring to the table? Again, the data is used to amplify the community change, as well as the information that we're able to get from this evidence-based platform on mental health, understanding that when we came to the table to have these really important discussions, one of the key pieces that we discovered was that mental health ran across the entire spectrum of work. So instead of having a separate subcommittee working solely on mental health, one of the key points that came out of the conversations was that mental health had to be part of the conversation at every single session that we had. And so when you look at the the community organizational chart for this work, you have a top layer of a steering committee that kind of moves and shakes and keeps everything going. And that's where your key community champions and stewards are seated. And those are the guys that can really affect policy change or throw in a few dollars on some given work or help us just really get things moving. But underneath that top layer, there are different subsections. And so there is a committee on education, there's a committee on health, there's a subcommittee on different key areas on transportation, which is the lack of transportation, which is a huge issue here also. But within all of these smaller groups, there's the always underlying conversation of mental health. It applies to all the different key areas and all the different sectors. So our community chose not to have it as a separate, hence why it's so important that we have it in our conversations. And because of that, this platform is crucial. We're in meetings sometimes and we'll be talking about ways to handle certain situations, and someone will get on their phone or their laptop and Google Credible Mind and see, well, what is out there? What recommendations are available? Again, a great opportunity to be able to easily access evidence-based information that might be applicable to the conversation that you're having. So it really helps us to work through and solve some critical community issues. And then also looking at the political system reforms, which are really key in the work that we're doing here in Greenwood. So as we move forward, the steering committee was specifically designed a little bit different than in the past. I think a lot of communities that try to pull together this type of work and community conversations start by looking at the data, like where are we failing, where are the problems, where are the issues that we need to address. We took a step back and said, first, let's look at ourselves as a community and let's start asking ourselves some better questions. Let's really look at ways to improve people's skills to participate effectively in that decision-making process. We really wanted to make sure that the folks around the table making these decisions were top-notch folks that had the skill sets, the necessary skill sets to be able to conduct this type of work. We also looked at making sure that the work that we were doing provided this framework for accountable decision-making. And we were really trying and focused on moving people from feeling helpless to having a sense of self-efficacy. And I think, again, having these tools at hand where folks can look at the data, make decisions on their own as to where they stand on any given issue, and then coming together as a group to be able to express those concerns and work with this consortium or to really air out and have the necessary discussions, sometimes really good and sometimes really challenging, to be able to come up with some solutions and being mindful of the resources and information that they're able to capture both on the data side and then also on the Credible Mind platform and the assessment side. Making sure that we're constantly doing a self-check is key. So I'm excited to share with you, again, the work that we've been doing, not only today, but happy to answer any questions that anyone may have on how we got started, where we're headed as we move forward in our journey here in Greenwood, and happy to just be of assistance. So I will pass it back over.
Here's the first question that came in, question for Credible Mind. Can you talk more about the analytical tools that are included with the platform? What are some of the examples of data and analytics that communities, hospitals, and employers are tracking?
Well, there are many. I'll just rattle off a few. So one is just trends and benchmarking. So how does the target population you care about, could be your employees in an organization, could be residents of a region in your state. So what are they worried about? How is that shifting? And what kinds of evidence-based approaches are they interested in? I've seen organizations spend a lot of money on like a meditation app when that isn't what that, people in that community are particularly interested in. So it's being data driven around what kinds of interventions or programs and policies you want to put into place. A second is all those assessments, that individuals can take pre-post assessments or can take assessments. There's risk stratification. You can see that aggregated data across a community, and you can then have those assessments and the results link people to resources at appropriate levels of care. So one person might want to learn how to, learn how to sleep better, and they can download an app, whereas someone else really needs to go get formal testing around sleep apnea or something like that. And then there are just insights, like, the kind of insights I mentioned at Madeira, where you actually learn about what people in a given group are worried about, like as in, to Jane's point earlier, testimonial level data, individual data that you can act on because you're now collecting that. Essentially, it's a feedback loop on all of the mental wellness issues that people are looking at, care about, worried about, and doing, and then you can get that and have various insights. One question that I saw very briefly, people were saying there's a lot of focus on the vaccines right now. Some folks are thinking of mental wellness as the mental health booster shot. While your community is giving the vaccine, this is sort of figuratively speaking with the right hand, your left hand can be giving someone a postcard or showing them a QR code that takes them to the websites that, like Maricel has, where people can get the mental wellness and resiliency from what they've suffered through the pandemic. So it can be at point of care.
Here's a question, I think, for all of you to talk to you different perspectives. What you were describing, can this translate to help the homeless community?
I'm happy to respond to that, but Jane, let me just ask if you want to.
Yeah, I think I mean, our part of the conversation was really about data-driven approaches, and from my background, I think all of this is interrelated. As I mentioned earlier at the top of this, I think we're all coming to root causes impacting health and mental health, and housing insecurity, food insecurity, access to care, all of those things, I think, are coming together. So the more we can address those mental health issues, but also the social determinants of health issues, I think all of that comes together to improve wellness. And just related to the data, because I did see something, one of the questions in chat about how this data comes together. So we find the data from nationally available platforms, and some of that is publicly available and some of that is privately available, and we're happy to share that. I think Scott has mentioned, because we're running out of time, that the slide decks will be available, but we're all also available for any personal consultations about the needs in your specific community. So I didn't want to leave this webinar without offering that.
Thanks, Jane.
And Robert, I'll just respond to the homelessness with one or two quick comments. The Conduit Healthy Communities group has also a wonderful database of best practices for communities, so that you can, with this platform, see what other communities are doing. And in the case of homelessness, I'll just mention one. I think it was out of Santa Cruz, where there were these empty lots, sort of blights, if you will, in town, and they turned those into community gardens. The homeless worked the gardens. The homeless got paid well above minimum wage. They had good food to eat. Probably more important than all of that, they had a great deal of self-esteem and a sense of purpose. The food went to schools, and the kids are eating organic foods at less than market rate. It's a great story. Those are the kinds of stories that you learn about in the Conduit Healthy Communities platform, of what others are doing. And as far as like the Credible Mind platform, that's down at the individual level. That also can be very helpful, especially early stages homelessness. People need to find resources. That's in there. They need help with some of the reasons of why they sort of ended up on the street, housing transitions and other things, So the answer is yes, both of these tools they're not going to solve the problem, but they can help you with strategies and approaches and best practices.
Thanks, Derek. I'm going to take one more poll here. It's on its way. And while folks get to answering that, quick question. This one may be best for Maricel. Is like, how do you encourage forward thinking and discourage that this is the way we've always done it mindset? I know you've had some experience with that.
So I think that was, like I said earlier, it was a really big challenge for us coming into small town where historical is such a huge component and where folks really look at, but we've done it this way always and it's been so effective. I think the data showed us otherwise. When we pulled the data, we saw that we were doing exactly the same thing for the past 10 years. Our hospital's community needs assessments from 1996 showed the same exact results 10 years later. And so the ability to see it, to really get our arms around it and get the community to understand we're not making these numbers up. Here they are. Here's the before. Here's where we are now. Set the platform for that conversation of we need to do something different. And then really looking at the folks around the table, like I mentioned, and starting to help them develop certain skill sets on decision making. And how do we start looking at the questions that we're asking? Because I think to change the mindset of change and to move that mindset into a more innovative mindset, we really have to stop for a minute and look at ourselves and say, are we really asking the right questions? Is the question, does such and such agency down the block still need to keep their doors open because they've been doing this for 20 years? Or how can we better work with this agency to bring them to speed and bring them up to align them with the work that needs to get done? So changing the questions that we're asking and the outlook on how we see all of this work, I think was really important. And that was our very first session for the consortium, was a training session for the folks around the table. So we kind of all start on that same page with the same thinking, with the same kind of prep for the work at hand. And rather than having our first session just looking at where we're failing. It was more, let's all start together. Here's how we're going to move forward the needle and really look at, let's start by asking the right questions.
Yeah, that actually, and maybe Jane and Derek, you can tag on to this a little bit, because there is another question here of what is one piece of practical advice you would give someone starting out in the community or population health around mental illness, which is along the lines of what Marisol was just speaking about, but from your experiences as well. Jane, do you want to take that?
And I hate to sound like a broken record, but I want to reinforce what Marisol was saying. For us, it was starting with the data. I think I think part of what we're coming into is realizing that we can't really make change working in our own silos and in different sectors within our own sectors. It's really about these cross-sector partnerships where you're working between transportation and healthcare and education. And the way to do that is often to have that common set of data that we're all looking at so that we can identify the problems in our community. And once we started with that, I know in Orange County, that's really when conversations began to happen, because once you can look at something in common and say, yep, that's the community, or that's the problem, or these trends are going up, everyone's a little bit more motivated, I think, to act and work across sectors. And as I mentioned in the presentation, sometimes that's working together because you can see the same communities that have lower education value have lower health outcomes or poorer health outcomes. And different interventions, we all have different tool sets, and we can use those to improve health in the community. And then there are the times when the data will tell you another story that's maybe really interesting, something that you didn't see before that also motivates action. So for me, it really begins with looking at a common set of data to identify your priorities. I'll hand that off to Derek.
Yeah, a little to add. I just completely agree. I think that, listen, it's about people and tools. So, you got to get the right folks together. Marisol has talked about that. That includes people that are more public health, community health oriented, along with more clinical oriented, and all the other organizations that need to come together, especially as you look at social determinants of health. And for them, they really need data, as Jane is saying. And then the second thing is to be evidence-based. And, the Credible Mind platform is just one example. There are many where you can actually put something into place and get moving right away. This is a crisis. We're not studying this problem for the next 5 years. The problem is here. It's in our doors. It's on our doorstep. The rates have all gone up, triple, quadruple. It's from domestic violence, social isolation, substance misuse, anxiety, depression, burnout. It's all off the chart. And we collectively, those of us a part of this, doing this work and on this webinar, we have a moral obligation to act. So I would say create a parallel path, get more data and continue to refine your targets, and adopt some tools, some programs and policies that are evidence-based and get moving, because people are in pain now.
Thanks. Can this program be applied to students? This program, I don't have a specific indicator of which one we're talking about here, but can this program be applied to students and their parents? So it sounds like universally.
For Credible Mind, the answer is yes, clearly. This is, in fact, we have universities using our system for students, and they take information home for their parents. It's actually a lovely story. Sometimes parents may not, they might be first generation immigrants, have language issues around accessing services, trust and belief issues. Having their kids come home with evidence-based practices that can be used can be a very powerful way to get the word out.
Will the demographics be more specific to cultural regions? For example, white European countries, African American, West Indian, rattles on about the different kinds of demographics that way. It's cultural sensitivities, I guess, taken into account with the way that some of this information is presented back.
Yeah, I think I think Jane and I would both just say yes. In other words, the data can help you see the differences in different groups, whether it's more geographic or more by affinity, culture, race, etc. And then once you have those insights, the Credible Mind platform absolutely can present information that's more in line with a cultural belief system, for example. That's a work in progress. It's going to take a long time, but everything from supporting languages to sort of cultural sensitivity. People like to see and hear people that often feel like them or that they trust. And it's perfectly appropriate to try to align that.
Can I add
Terrific.
on to that, which is that I think community partners that are already in those, especially the vulnerable communities, are such an asset in this regard. Kind of what I was saying is data gets you started, but you really do need to build on that data to understand communities and their lived experiences. And there are many community-based organizations that are already doing that work, and partnering with those community-based organizations and acknowledging their experience and expertise, I think is really important when we're addressing mental health needs, especially in understanding the cultural context.
Terrific. And then one last question here, because we're running up at the top of the hour here. What method did you use to recruit steering committee participants? I think you got to that quite a bit, Maricel, but just wanted to see if there were any additional tips or tricks in that department, especially when you're trying to bring diverse groups that, work together.
So of course, we wanted to look at folks that could help us move the needle as fast as possible, especially in those areas that we had some low-hanging fruit in terms of solutions. So really looking at folks that had either their hands on funding opportunities, so looking at folks that could easily approve or move some dollars. But funding's not everything when you're looking at this type of work. Looking at policy change, bringing our elected officials to the table, making sure that we have both city and county council folks at the table, so that if some ordinance needs to be reviewed, if something needs to get changed or updated, or if there's even a question of why have we been doing this for 20 years, it's time to change, we would have that feedback right there at the table and get that moving and shaking. So when we looked at the leadership that needed to be around the table, we took into consideration the level of response, the level of decision-making that folks had, and then we also made sure that we had someone representing each one of the sectors, the important sectors that are outlined on our platform. There are 8 sectors, and so we made sure there was someone representing each one of those. And then threw in a few extras. Some of our state agencies certainly want to make sure we have our Department of Health at the table, and our rural health folks, and our Department of Social Services. I mean, they do need to be at the table. They're state entities, but they certainly are local enough to understand and add to the conversation and add to the solution making that needs to occur. So we really dissected the community both locally and statewide, and even actually have a couple of national partners at the table coming in, just helping us make some of those decisions, helping share their experiences, what's worked in other communities that they've worked with, and took all of these key points into consideration as we determine. And then also, as I mentioned earlier, we have some subcommittees and subgroups that we've designed. And so trying to decide who belongs in that steering committee piece for the larger conversations, more global type of conversations, whereas or versus the more dissected conversations and specific into actual neighborhoods and actual sides of town, and then in the key areas and the key levels. So there's a wonderful little chart of how this whole consortium is breaking out, and it keeps growing. I mean, there's so many arms and legs to it as you keep dissecting it. So that's kind of the methodology we utilized. So far, so good. Every now and then we'll get somebody who'll raise their hand and say, hey, where do I fit? And just trying to make sure that we have the right fit for the right people in the right spaces.
I know we're at the top of the hour, close to it. I just wanted to make sure folks heard this offer from our panelists that if anyone's interested in an educational brainstorming session, send me an email at robert@crediblemind.com. That's robert@crediblemind.com. You got the email from me for the actual link to this webinar, so just reply to that too. And I'll make sure that our panelists get coordinated on that for you and pass that information along to them. And I also know that when you answer a poll online, you'd really like to know, well, geez, what were the answers? I'm going to just rattle this off for you. I thought I could present the numbers in a visual, but what is the biggest challenge in the mental health field at the moment? The number 1 and 2 actually tied answers are stigma and access to care. Knowledge gaps came in at that was at 33 and 34% respectively. Knowledge gaps came in at 16%. Workforce shortages at 14%. So that was pretty interesting. Then, have you taken a population-based approach to mental health focused on community, patients, staff, and employees, covered lives, or haven't done that yet? So 50% of the folks said, yes, we've taken a population-based approach in the community, 10% for patients, staff and employees, only 2%, and no answers for covered lives. So predominantly a community-based activity at the moment. And with that, I'll turn it back over to Jane just to kind of wrap us up as our host of the hour. Does that make sense?
Everyone for attending. I think this was a lot of rich discussion. I could have sat on here for another hour. Thank you, Robert, for being our administrator, and Dr. Van Brunt and Maricel for your time today. I think Robert will be sending out some follow-up information for you all. There were requests for slide decks as well as a recording, and this will be sent out to all who've registered. Thank you again, and hopefully we can continue this conversation on an upcoming webinar. So,
thanks again.
Thank you, everybody.